During this presentation, we will outline what is meant by concurrent strength and endurance training. We will then implement a resistance training program for a middle-aged woman to be used as a tool to improve her endurance performance, with the aim to complete a half marathon. The outcomes of this resistance training will then be discussed. Concurrent strength and endurance training is a leading training strategy used by many athletes as a technique of improving a vast range of physiological abilities. Concurrent strength and endurance training can be defined as when the athlete performs strength training and endurance training simultaneously within a set training period. There is inherent risk of musculoskeletal injuries for runners, with studies suggesting that contributing factors include inadequate rehabilitation from previous injuries, overtraining, muscle imbalances, as well as incorrect shoes. Lower extremity limbs were found to be the most predominant running related injury, with the knee being the most vulnerable site of injury, followed by the ankle.
Okay, so our case study looks at a 35-year-old female. She is married and is a receptionist. Her family history involves diabetes, cardiovascular disease and smoking. Her medical history, she has type 1 diabetes. She uses an insulin pump and Freestyle Libre flash glucose monitoring system. She suffers from decreased insulin resistance. She takes cholesterol lowering medication and she did break her tibia 5 years ago. She is relatively active. She completes 2 group cardio classes per week at her local gym, which is Good Life Health Clubs. She also does a Pilates session once a week, and she occasionally swims for just general fitness. Her fitness goals include aiming to improve aerobic and muscular endurance with the implementation of a resistance training program, as her ultimate goal is to run in the Melbourne Half Marathon in 6 months' time, which is a distance of 21.1 kilometres, with her long-term goal being to complete a full marathon the following year, which is 42.195 kilometres. She currently has access to the Good Life Gym, as she has a membership, which is 10 minutes from her house, and she'll be starting her resistance training programs with a personal trainer. Her availability includes before and after work. She works from 9 a.m. to 5 p.m. Monday to Friday and 8:30 a.m. to 1 p.m. on Saturday, so she's able to train before and or after work during the week. Pre-participation screening should be completed prior to commencing a training program. The pre-screening allows for a number of risk factors to be identified, including injuries, health conditions and current physical activity levels. If the subject has a health condition that could be affected by exercise, they must consult with their doctor and obtain written medical clearance to exercise. It has been identified that the client has type 1 diabetes, and she has maintained written medical clearance from her doctor. The pre-testing screening process should begin prior to the commencement of any training program. It provides an indication of injury risk factors of the client before training load is applied. The testing also provides baseline measures that can be referred to and tracked throughout the training program. Repeat testing should occur at the end of the training program. The informed consent form gives the trainer and/or health professionals access to the client's results.
Initial fitness testing protocols were utilised to determine the client's fitness so appropriate training could be prescribed and to monitor the effect of resistance training. Protocols were selected on sport specificity, demographic of the participant, and to replicate the physiological variables that determine success in marathon events. Therefore, providing a baseline of results to regulate the client's fitness in areas such as strength, power, and aerobic endurance. The standing long jump was administered to assess the client's explosive leg power production. The protocol followed was written by Tanner and Gore, requiring a subject to jump forward as far as possible and land on 2 feet without falling backwards. Both the PWC-170 and the 3-repetition maximal test were completed as sub-maximal exercise. This was decided as it was deemed unrealistic for a participant of this demographic to undertake maximal testing. Participating in sub-maximal exercise also allowed prevention of injury and reduced large degrees of muscle soreness. 3 repetition maximal squats are a modified ESSA protocol derived from 1 repetition maximal testing. Athletes are to complete 3 back squat repetitions successfully until a maximum weight is determined. 1 repetition max is then calculated from these results, enabling a practitioner to assess maximum and explosive strength. Lastly, an ESSA PWC-170 protocol is a maximum physical work capacity test which allows maximal aerobic capacity to be calculated from results. The client will complete increasing consecutive workloads on a treadmill. Blood pressure, heart rate, and self-perceived fatigue are monitored until a heart rate of 170 beats per minute is reached.
The PWC-170 treadmill test was implemented into the testing battery as a sub-maximal indicator of aerobic capacity. The maximal amount of oxygen consumption during exercise, expressed as VO2 max, is used as an indicator of the body's ability to transport and distribute large amounts of blood, as well as its ability to utilize oxygen from the blood within the muscle cell, therefore representing the efficiency of aerobic metabolism. Thus, a biological adaptation resulting in a higher VO2 max would suggest a more efficient aerobic metabolism, which would delay fatigue, allow the athlete to maintain a more consistent velocity, and increase on-track performance. Prior to implementation of our program, the athlete recorded a VO2 max of 39.6 milliliters per kilogram per minute. Normative data published by the American College of Sports Medicine suggests that this places her in a good range for the athlete's gender and age. It is often proposed that lower extremity strength is a vital component in improving endurance running performance and running economy by positively impacting trunk stability, the muscle's work efficiency, as well as a high level of motor unit recruitment. All factors of which are strongly correlated with an increased energy transfer and improved running speed. 2 lower body strength tests were tested on the athlete. Firstly, a 3 repetition maximum weighted back squat was implemented to measure absolute leg strength. As the athlete is fairly untrained in resistance training, the 3RM test will be used as opposed to the 1RM to ensure safety. From this result, the approximate 1RM will be calculated. In initial testing, the 1RM squat was 1.33 kilograms per kilo of body weight, classifying the athlete as average by the Australian College of Sports Medicine's published normative data. To measure explosive strength, the broad jump test was employed. Explosive strength is essential for stride length and efficient ground transfer time. When first tested, the athlete jumped a total of 175 centimetres with normative values provided by ESSA, defining this as good.
When looking at the specifics of exercise prescription for our client, the client is implementing resistance training into her fitness program for the upcoming 12-week block. Resistance training is being applied in an effort to improve the client's muscular endurance and power. These 2 fitness factors are extremely important components that must be improved in order for the client to reach her goal of running a half marathon in 6 months' time. According to Hisham's study in 2016 on the impact of concurrent training on certain pulmonary physical variables, 8 weeks of concurrent strength and endurance training is proven to have advantageous improvements in muscular power, maximal oxygen uptake, and running speed in completion of 800 to 1,500 metre events. In addition, another report stated that VO2 max increased by approximately 8% following 10 weeks of resistance training. The results suggest that VO2 max may increase in subjects following resistance training when their initial relative VO2 max is lower than 40. The client is currently physically active with a VO2 max of 39.6. Therefore, the implementation of resistance training to improve VO2 max is relevant for this client. When looking at the type of exercise appropriate to the client is physically active and currently completes 2 aerobic group classes at the gym per week as well as 1 Pilates session. However, the client has never done specific resistance training. The client will begin the first 4-week block of resistance training with use of only body weight and machine exercises. Bodyweight exercises do not require a great deal of skill, making them extremely easy to execute and also very safe. The machine weights are implemented again due to inexperience. It is a safety mechanism as closed chain exercises are used. Closed chain exercises mean that the person's limbs remain in contact with the immobile surface, being the machine equipment. The client will also be completing 2 aerobic sessions per week in her new training program. The aerobic sessions will focus on maintaining and improving aerobic capacity and muscular endurance. The aerobic sessions are relevant to the client's goal of completing the half marathon.
An individualised training prescription was designed for the client based on her experience and goals of running a half marathon. In regards to the resistance training implementation, the following variables were analysed from the guidelines of exercise prescription, and 2 main goals of resistance training were identified. These include the improvement of muscular endurance and power. Therefore, a program was created that followed these guidelines. The program was 12 weeks in length, and for the first 4 weeks in her resistance sessions, it was required that she proceeded with low reps and sets. This is due to her previous inexperience of resistance training, and in order for the sessions not to be too difficult for her to gain compliance to the exercise program. Additionally, rest periods are specifically short between each set in the program. Short rest periods that are less than 60 seconds will generate higher cardiovascular demands and therefore improve VO2 max. This is an important outcome for the client, as improvement in VO2 max will be beneficial in achieving her goal.
So our 12-week training program that we have designed for the client is broken up into 3 4-week blocks, consisting of aerobic sessions and resistance sessions. So in weeks 1 to 4, there'll be 2 aerobic sessions. Firstly, one 30-minute run, either on the road or a treadmill. Intensity would be 70 to 80%, and the client is to record how far they run in that time frame. They'll also be doing one 45-minute swimming session at 70 to 80% intensity as well. For the resistance training, there will just be body weight exercises involved, 50% intensity, 50% of 1 RM. So on Monday, they'll be looking at upper body strength. To warm up, there'll be a 15-minute jog on the treadmill. Then they'll go into 3 sets of 10 reps of push-ups. They will need to drop to their knees if they have to. Next, they'll do 3 sets of 8 reps chin-ups, machine assisted. Then 2 sets of 10 reps of seated cable rows. Then 2 sets of 10 reps wide grip lat pull down. Then 2 sets of 10 reps triceps pull down. Then 2 sets of 10 reps of a chest press. And that completes the upper body. Then for Wednesday, they'll be doing lower body. They'll start off with 500 metres on the rower, so that's warm-up. They'll go into 3 sets, 10 reps of body weight squats. Then 3 sets, 10 reps of body weight lunges, so that'll be each leg. Then 2 sets, 10 reps of leg extension. 2 sets, 10 reps of leg curls. 2 sets, 10 reps inside thigh on the adduction machine. Then they'll focus on the outside of the thigh, so 2 sets of 10 reps on the abduction machine. 2 sets, 10 reps of leg press. 2 sets, 10 reps of just calf raises, and that completes the lower body session. And then on Friday, they'll focus on the core. They'll again start with a 15-minute cycle on the bike just for warm-up. Then they'll go into 3 sets of 45-second plank holds, and that'll be done on their forearms. Then 3 sets, 10 reps of mountain climbers, so just counting one leg only. Then they'll go into 2 sets, 10 reps of elevated hip raises. 2 sets, 10 reps of crunches. 2 sets, 10 reps bicycle crunches each leg. And 2 sets of 30-second side planks each side. So going into the second 4-week block, which is weeks 5 to 8, again there will be 2 aerobic sessions and 3 resistance sessions per week. So looking at the aerobic sessions, they'll be required to do a 6-kilometre run So based on their 30-minute run in the first 4-week block, they completed around 5 kilometres each time. So this time they'll be doing a 6-kilometre run, and they'll be aiming to complete it in less than 35 minutes. So this will be about a 70 to 80% intensity. And again, they'll need to record their distance. On Thursday, they'll again be required to do one 45-minute swimming session at 70 to 80%. Now moving into the resistance training, which is again body weight or 50% of their 1 rep max. On Monday, focusing on upper body again, they'll do a 15-minute jogged warm-up on the treadmill. Also with this session, they'll be only having 30 seconds rest, which will be timed between sets, so they can target their aerobic endurance. So starting with 3 sets, 12 reps of push-ups, again dropping to their knees if they have to. 3 sets, 10 reps chin-ups, machine assistance. 2 sets, 12 reps of seated cable row. 2 sets, 12 reps of wide grip lat pull down. 2 sets, 12 reps of triceps pull down. 2 sets, 12 reps of chest press. So obviously increasing the reps from the first 4 weeks. Now Wednesday, focusing on lower body, they'll start with a 500-metre warm-up on the rower. Then move into 3 sets, 10 reps of bodyweight squats. Then 3 sets of 12 reps body-weighted lunges each leg. 2 sets of 12 reps of leg extension. 2 sets of 12 reps leg curls. 2 sets, 12 reps inside thigh on the adduction machine. 2 sets, 12 reps outside thigh on the abduction machine. 2 sets, 12 reps leg press. 2 sets, 12 reps of calf raise. And then Friday, again, focusing on the core, they'll begin with a 15-minute bike ride for warm-up, then moving into 3 sets of 1-minute standard plank on their forearms. So this has obviously been increased since the first 4 weeks. Then move into 12 reps mountain climbers each leg. 2 sets, 10 reps of elevated hip raises. 2 sets, 12 reps of crunches. 2 sets, 12 reps bicycle crunches each leg. 2 sets, 45-second plank on each side. Okay, so moving to the last 4-week block, which is weeks 9 to 12. Again, we'll be doing 2 aerobic sessions and 3 resistance sessions per week. So for the aerobic sessions in this block, they'll be required to do, on the Tuesday session, 1 800-metre run for their warm-up. And then they're looking at doing 3 1-kilometre time trials, and each 1-kilometre time trial will be at maximum effort. The client will also be allowed to have 3 minutes recovery between each run. On Thursday, they'll be doing a 40-minute bike ride and recording their distance travelled. Moving into resistance training, on Monday again the focus is upper body, so the intensity will be again 50% of their 1 rep max, and keeping their recovery between the sets at a timed 30 seconds, so they're still targeting that aerobic endurance. So Monday, upper body, they'll start with a 15-minute jog on the treadmill for warm-up. Again, the sets and reps have been increased, so they'll move into 3 sets, 15 reps of seated cable row, 3 sets, 15 reps of wide grip lat pull down, 3 sets, 15 reps of triceps pull down, 3 sets, 15 reps of chest press. Here we've implemented free weights due to vast improvement in the client's muscular strength. However, it will still be quite a low weight. Then they'll move into 3 sets, 8 reps bicep curls, alternating arms, and then finishing with 3 sets, 8 reps of barbell bench press. And then Wednesday, lower body, will begin with their 500 metres on the rower for warm-up. Move into 3 sets, 15 reps of leg extension, 3 sets, 15 reps of leg curls, 3 sets, 15 reps targeting the inside thigh, so on the adduction machine again, 3 sets, 15 reps targeting the outside thigh on the abduction machine, 3 sets 15 reps of leg raises, 3 sets 15 reps calf raise, and then we're implementing the free weights again due to the client's improvement in muscular strength. Again, it's going to be at a low weight. So 2 sets 10 reps of weighted squats and 2 sets 10 reps of weighted lunges each leg. Then moving into the core on Friday, 15 minutes on the bike again just for a warm-up. Then they'll move into 3 sets of 45-second plank on the Swiss ball. So implementing the Swiss ball makes it a lot harder to balance and remain stable. They're moving into 3 sets of 30-second fast mountain climbers each leg. Then moving into 2 sets, 10 reps, elevated hip raises with a weight plate. 3 sets, 10 reps of crunches. 3 sets, 10 reps of Russian twists holding a weight plate each side. Then finishing with 3 sets, 30-second side plank with rotation each side.
The client suffered from muscle soreness, but it was important that she stretched after each exercise session. These stretches were shown to her, and an explanation of why stretching is important was explained. Stretching plays an important role in the prevention of injury. The client also initially experienced delayed onset muscle soreness, also known as DOMS, due to some of her muscle groups not being specifically targeted recently or frequently. DOMS occurs 24 to 48 hours following resistance training, particularly when eccentric exercise is implemented. The extent of muscle soreness depends on the intensity, volume, and the training status of the individual. Therefore, the training program was designed so that she did not overtrain from the beginning of her program, and this is highlighted through the initial low intensity and volume. Additionally, ensuring that the same muscle groups were not trained too often allowed for recovery and prevention of further injury.
There are a number of physiological adaptations from resistance training, including increased muscle cross-sectional area, mostly in type 2 muscle fibers, increased muscular strength and power, increase in balance and coordination, increased muscular endurance and VO2 max. Anaerobic energy source substrates are also enhanced. This means increased storage of ATP and CP within the muscle, reduced acute increases in heart rate and blood pressure during a workout at submaximal or maximal effort. This resulting in faster recovery of heart rate to resting levels after a workout.
The aforementioned testing was repeated post-implementation of the resistance training program. Results yielded indicated a 10% increase in VO2 max, with the athlete recording a VO2 max of 42.4 millilitres per kilogram per minute. Lower body absolute strength improved by 20%, with the athlete's 1RM increasing from 1.33 kilograms to 1.47 kilograms per kilo of body weight. Explosive power in the lower extremities also increased, taking the athlete from a good classification to an excellent classification, with results yielded from the broad jump testing increasing from 175 centimetres to 182 centimetres.
It is important to understand the demographic requirements so exercise prescription is modified to suit the client. Maintaining a healthy diet is imperative for the management of type 1 diabetes and can be achieved through nutritional therapy. Nutritional therapy ensures the client's diet is sufficient to maintain blood glucose-food interaction with exercise and insulin sensitivities. This helps prevent hypo or hypoglycemia. Carbohydrate intake was specially analysed throughout to maintain glycemic levels. The exercise prescribed for the patient will provide healthy weight maintenance, increased insulin sensitivity, and physical fitness ability. The exercise was prescribed due to ACSM recommendations for physical activity. However, monitoring for hypo and hypoglycemia was administered due to the risk associated with the diabetic population. Multiple hormones such as insulin, glycogen, growth hormone, cytosol control, and fuel metabolism balance glucose uptake through exercise of muscles and hepatic glucose production. The balance between insulin secretion and counter-regulatory hormones was reached through the exercise duration, type, and intensity prescribed. Frequent insulin was taken due to personal medical prescription, and glucose was monitored with a Freestyle Libre system. Hypoglycemia occurs with excess counter-regulatory hormone with insufficient oxygen. This results in excessive hepatic glucose production and limited glucose uptake to skeletal muscle. Hypoglycemia can occur post, prior, or during vigorous exercise. The patient was required to dose correct amount of insulin at meals, so hypoglycemia, ketosis, and insulin emission were all avoided, as this is common for diabetics undertaking vigorous activity. Hypoglycemia was avoided by achieving a blood glucose level of 100 mg per deciliter or higher during warm-ups. This was reached by reducing the dosage of prandial insulin or for the preceding exercise meal or increasing food intake. Additional carbohydrates were also consumed during sessions of prolonged training. The patient was monitored for hypoglycemia post-training and again 7 to 11 hours after exercise. This was to identify possible lag effects caused by repairing glycogen stores in muscles. Running surface was standardized to reduce shin splint occurrence and utilization of primary physical activity progression. Injury was also prevented through appropriate warm-up, stretching, and post-exercise cool-down methods.
In summary, a 12-week resistance training program was implemented to be conducted concurrently with endurance training for a 35-year-old woman wishing to run a half marathon in a time frame of 6 months. Previously, she had been moderately active. Given that her main form of exercise had been aerobically focused, the program was designed for a beginner with potential for the difficulty to be progressed with the athlete. The resistance training program concentrated on improving aerobic metabolism, lower body absolute strength, and lower body explosive strength. The program tailored for the athlete was successful in all of these areas.